Hi, this is Bazi from Meslova. In previous session, we learned about how the heart transport blood through its vessels, that is blood vessels, and how the heart have its own function. Now, how this coordination of chambers and valves involved in the pumping of the blood. We know that the four chambers of the heart are creating a rhythmic dancing of pulsation by contraction and relaxation of the chambers and valves, and creates a music called the lub dub. The beat sound of the heart is nothing but measured by heart rate. You know, the number of heartbeats per a minute, we call it as heart rate. This heartbeat starts in the womb from the 21st day of the embryo and until the death. If it stops, that means it leads to the death. You may observe your own heartbeat or your friends. Whenever you visited a doctor, and you can observe a doctor holding a wrist, and also he observes the clock for a minute. And actually what he did, he just calculating and counting the pulse rate or at your wrist point, and also he counts the heartbeat by his stethoscope, and that we call it as a pulse rate. The pulse rate is varying from person to person and also from situation to situation. You know, in those days doctors doesn't have stethoscope to listen the music of the heart, but in 1816 Rene Laennec is one of the doctor or physician, and he discovered the stethoscope by making paper tube and by using the bamboos, and finally now we see the latest model of the stethoscope. The average heartbeat of a person is depends on the age, gender, activity, and also the genetics which involved in it. The average resting heart rate ranging from 60 to 100 beats per minute. As you fit more, the less is the heartbeat. It is about 40 beats per minute. We may see it is in athletes because they are more fit. You also observe your own pulse by doing simple activity. Just if you take a button and also insert a matchstick in it and put it on your wrist. Observe the movements of the matchstick. Then you can find the pulse rate per minute of your own heart at resting position. Do it the same after running or jogging. Repeat this experiment on your friends, parents, or your grandparents and note down the pulse rate of each one at various conditions and situations. I think you may find different types of results which are vary from person to person, situation to situation. 100 to 150 beats we may find in 0 to 3 months babies, whereas 90 to 120 beats per minute we may find in 3 to 6 months babies. 80 to 120 beats we may find in within 1 year baby, from 6 to 1 year baby, whereas 70 to 130 beats per minute we may find in below 10 years age people, from 1 year to 10 years. We may find 60 to 100 beats in average adult. But if you see in well fitted and trained athletes, we may find 40 to 60 beats per minute. If any imbalance is found, generally we call and use the term the BP. Generally this term we are used on the people who are very angry and arrogant. But in reality, the blood pressure is a measure of heartbeat, that is one contraction and one relaxation, and it is nothing but the systole and a diastole. In a healthy person, At rest, it is about 120 by 80 mm of Hg, but it will change depends on person's activity and his situation. 120, the systolic pressure, which is the peak pressure produced by the ventricles while contracting, and 80 mm of Hg, which is called as diastolic pressure, in which the pressure exerted by the arteries after relaxation of ventricles. These two numbers gives the both pressures of your arteries, that is peak pressure, that is systole, and the low pressure, that is the diastolic readings. And the doctors measured this reading by using a device called sphygmomanometer. People who have more than this reading at rest, we call it as hypertension or high BP, whereas the people who have lower than this reading at rest, we call them as low BP or hypotension people. This is due to number of reasons. One of the main reasons are changing in their habits, like especially eating habits and lifestyle changes, and also addiction to bad habits and irregular discipline about the lifestyle. All these things are leading to the fluctuations of our heartbeat, and which are indirectly or directly affects on our blood pressure, that is it may cause the low BP or high BP. Prolonged BP may leads to the damage of different types of organs in our body, that is brain and heart itself, and different types of arteries, lungs, kidneys, and every part of our body may damaged by this BP. To understand in detail more about this, we have to know about the lub-dub sound in a cycle called as cardiac cycle. One contraction and one relaxation of these arteries and ventricles producing one sound of lub-dub, and this sound which is produced one cycle of this lub-dub, we call it as the cardiac cycle, in which the pumping and receiving of the blood from the heart to the body and heart to the lungs and heart again, and this will happens within this cycle. And actually we listen this music, and it is generated by the closing and opening of valves occur within the heart. The lub sound we heard is produced by mitral and tricuspid valves closing. This high pressure caused by the contraction of ventricles, it's called a systole. The dub sound we heard is produced by aortic and pulmonary semilunar valves closing while ventricle relaxes after pumping of blood, that is diastole. Let me know that how this cardiac cycle starts actually. It has actually two phases. One is by heart itself, it creating its own pulsation. Another is by how the complete cycle is going within the chambers of the heart. The heart have its own pulsating tissue, that is nodal tissue, which is made up of pacemaker cells, that is intrinsic cardiac conducting system. A cardiac cycle is produced by electrical impulses in the heart. The cardiac cycle starts when an electrical impulse or action potential is generated by the sinoatrial node or SA node. The electrical impulses travels along specialized conducting fibers in the walls of the atria, stimulating the atria to contract and pumps blood into the ventricles. Impulses travels very rapidly. As a result, all the muscle cells in the atria contract together, producing a coordinating pumping action. The impulses also travel across the right atrium to the atrioventricular node, where it is delayed slightly about 0.1 second to allow the ventricles to relax and fill with blood before they contract. Then the impulses travel along the bundle of His, where the conducting pathway divided into the left and right bundle branches which lies in the interventricular septum. From the bundle branches, impulse spread into the inner walls of the ventricles via specialized conducting fibers called the Purkinje fibers. Finally, the impulse travels up the outer walls of the ventricles towards the atria. The rapid and controlled spread of the electrical impulse through the ventricles stimulates the muscle cells in the ventricles to contract together and pump blood efficiently to the lungs and the body. And next step, it is the electrical pathway where it generates its own electricity. But how the complete cycle is going on and how blood passes through the creating the music systole and diastole, that is lub-dub. If you imagine the heart, the four chambers of the heart is rested, and if you start from the right atrium and a single cardiac cycle starting with the deoxygenated blood flows from the body into the right atrium by the superior and inferior vena cava. At the same time, oxygenated blood flows from the lungs into the left atrium by the pulmonary veins. Now the right and left atria contract at a time, forcing the blood to enter into the ventricles through the opening of both tricuspid and bicuspid walls respectively. Once both of the ventricles are filled by blood, the walls are closing to prevent blood flow back into the atria. Then the ventricle starts contracting and atria starts relaxing. When the walls are closed forcefully by the contraction of ventricle, we listen the sharp sound, that is the lub. One ventricular contraction, due to pressure, the blood moves into the pulmonary artery from right ventricle by forcing the opening of pulmonary wall to the lungs, where the exchange of gases takes place and the oxygenated blood reaches to the left atrium by pulmonary veins. From the left ventricle, the blood moves into the aorta by forcing aortic wall to open. From there, oxygenated blood flows around the body. The walls which are present in the blood vessels are closed to prevent backward flow of blood into the ventricles. Now we can listen to a dull sound of the heart, that is the dub. The atria are filled up with the blood and ready to pump the blood into the ventricles. The ventricles are relaxes, ready to accept the next intake of blood. Then the cardiac cycle is now complete by this generation of lub and dub sound. This whole process is completed within 0.8 seconds. How this value will come? Here, if you take the average heartbeat of any adult is about 72 to 75 times. If for example, if within the 60 seconds, that is 60 by 72, you may get this value 0.8 seconds. The time needed for atrial contraction or systole is about 0.11 second to 0.14 seconds. In this meanwhile, the atria will relaxes about for 0.1 seconds. Whereas the ventricle contraction, it needs to contract, the time is about 0.25 to 0.35 seconds. And in this meanwhile, the ventricle relaxes about 0.5 seconds. And the total time we can calculate it about 0.8 seconds. Even the joint diastole between the auricles and ventricles is about 0.4 seconds. Hence, the blood is pumped in blood vessels within an intervals. The tissue will not receive the blood continuously, but it is receiving the form of spuds. Hence, we feel the pressure of the blood when we put our fingers on the wrist. We feel it is flowing in our vessels, what we call it as a pulse. Our circulatory system can move 1 ml of blood from top to the bottom and from back to the heart, that is approximately 2 meters, within 1 minute. The another miraculous property of the blood is clotting. You know, because of this character, most of the organisms are survive even they met with severe injuries. You know, our blood needs to clot about 3 to 6 minutes. Blood clots are made up of activated platelets, red blood cells and fibrin, and together collectively they are involved in the clotting process. You know, about 30 types of proteins are involved in the process of clotting, and which we called as factors. These are called as clotting factors. These platelets are exposed and they are activated, and aggregation begins when vascular injury exposes collagen and von Willebrand factor from within the vessel wall to the blood. Platelets adhere to these proteins and become partially activated, changing shapes and releasing signaling molecules, which recruits more platelets to the site. At the same time, a protein called tissue factor triggers initiation of the coagulation cascade, the process that leads to full activation of platelets and the generation of fibrin and clot formation. Vascular injury causes the tissue factor outside of the cell in the vessel wall to come into contact with factor 7A and factor 10A in the blood, leading to the production of small amount of thrombin. This thrombin fully activates platelets and triggers a cascade of clotting factors that activates each other, culminating in factor 10A, mediated generation of a large burst of thrombin production on the platelet surface. One molecule of factor 10A leads to the formation of 1000 molecules of thrombin. Thrombin converts the soluble fibrinogen into insoluble fiber strands at the site of vessel injury, while at the same time activating factor 13 protein to cross-link the fibers. The fibrin mesh stabilizes the clot and traps more platelets and red blood cells, facilitating its growth. In normal physiological conditions, this process of clot breakdown or fibrinolysis begins as the structural integrity of the vessel to restore the condition. Endothelial cells begins to secrete a protein called plasminogen activator, which activates the protease plasmin to degrade fibrin, dismantling the structure of the clot and restoring the integrity of the original structure of the vessel. In some people, due to deficiency of the vitamin K, the clot is somewhat delayed because vitamin K is playing very important role in the blood clotting. If anybody having this deficiency, automatically blood will not clot within this time, that is 3 to 6 minutes. Somewhat it may delay. Till now we understand the blood pressure and the cardiac cycle, and also how the rhythm of the heart pulsating and producing the music, that is lub dub, systole and diastole. And we will meet and discuss about the lymphatic system and also various types of heart diseases and problems involved in the blood circulation. Until then, bye bye, see you soon, thank you.